Welcome back. It's still Breakfast Daily, and right now we are about to have a conversation, and this conversation is about maternal health. So if you're interested in the woman's health, if you're interested in your own health, or interested in any woman's health around you, please sit down and enjoy this conversation. So today marks World End Obstetric Fistula Day, and today we're going to be shining light on a condition that affects some women, especially in vulnerable states, yet it remains hidden in silence, and we are wondering, why is it not spoken about so much? So fistula is a preventable childbirth injury caused by prolonged obstructed labor without timely medical care. And I'm sure you have so many questions. That's why we have in the studio with us Dr. Francis Eshun Baidoo, who's the Safe Motherhood Program Manager at the Family Health Division at the Ghana Health Service. Good morning, Doc.
Morning.
How are you?
I'm fine, thank you.
Did I explain it well? I'm
Pardon?
fine. Did I explain it well?
Yes.
Did I try?
Yes, you did.
All right. All right, Doc, you're welcome to Breakfast Daily, and happy World End Obstetric Fistula Day. I'm excited about this, that we get to talk about it.
Yes.
All right. So tell us, why is it important to celebrate this day?
Yes, so this day is very important because it's a day that we use to create awareness about obstetric fistula. It's also a day that we use to mobilize cases, fistula cases that are in the country. We go out, search for those cases, bring them to...
Oh, wow, you go out to search for it?
Yes, currently that's ongoing. Because some of these cases are in hard-to-reach areas. They are marginalized. Some of the women are poor. They don't have the resources to come over to a hospital or health facility to get the needed care. So there is case mobilization, and these women go to the hospitals. They are screened, and then they are prepared, and then surgery is done for them. Yes.
All right, so let's get straight into the whole thing. How does it happen? How does obstetric fistula happen? Okay. That's a mouthful.
Okay, so it happens, it's a delivery injury, okay? So it happens when a woman is going through the process of labor. Now, God being so good, there's a time frame within which a woman is supposed to go through the process of labor. But sometimes in some women, this process may not proceed exactly how it's supposed to proceed. So if you look at the diagram that we have on our screen here, you can see the baby in the womb, and then this is the woman. This is the birth canal over here. Now, to put this into context, you can see that we have an organ here which is called the bladder. And the bladder is where urine is stored, so that at a time that you feel like urinating, then you can go and then urinate. And then we have just behind the vagina, we have the rectum, where feces is also stored, so that at a point in time when you feel like passing stools, you can do that. Now, for a fistula to happen, usually what happens is that you have the baby which is supposed to pass through the birth canal. Sometimes it delays. It takes a longer time. And whilst the head of the baby is there, it presses on these organs as well as the vagina. So over time, you have an injury that occurs, and then eventually you have a communication, a hole between the vagina and then the bladder, or the rectum and then the vagina. Yes, you have a hole. So with that, what happens is that then you are not able to control any of these.
So you're not able to control any of them?
Any of them. So you have continuous leakage
of both
urine and feces. Yes.
Wow.
So if you look at this other diagram, you can see the hole that is there,
right.
up there. So when the urine comes, it just
goes
passes into
there
the
and
vagina and then comes out. So there is no control for this.
Wow. So it's 2025, and you know, a lot of advances have been made in maternal health care. So why is it still prevalent in some parts in the country?
It's still prevalent because of poverty, also lack of awareness, and then also some of the deliveries are also not conducted in a skilled fashion by somebody with a competent skills to conduct labor and then delivery. And then also we have certain instances of teenage pregnancy, early child marriages. Yes. So these
I've actually read so many essays when it comes to the early child marriage part. Young girls having fistula.
Yes. So in young girls, because they are, you know, the pelvis
it's not formed.
It's not properly developed. It's not adequately developed. Then they tend to have this complication. And then also in instances where you don't have cesarean section being available in a timely function, a timely manner, then the injury occurs and then they have the complication.
Right, so what are the early signs of fistula, and can it be prevented entirely with proper care?
Yes, so the early sign is usually the leakage of the urine. So after delivery, sometimes some women go home and then later they realize they have this problem. But the unfortunate thing is, because some women are not aware that there's treatment available for this, then they may stay at home for a longer time before they present to the hospital. Usually if it comes, if you see this early, you present in a timely function, in a timely manner, then the repair can be done immediately.
Okay, now let's talk about that urine part. I've seen some women say, I don't know if it's fistula, but like very prominent and intelligent women actually say, oh, after childbirth, when they laugh, they still leak a bit. So how would you know it's just that, you know, that simple one or fistula?
Okay, so it may be difficult to tell between the two. The only way you can be able to do that is when you present to the hospital where a healthcare professional will do the necessary assessment and then decide what the problem is.
So what is the typical recovery process like after surgery? Okay,
so after surgery, usually you'll be on admission for about 2 weeks.
Oh, okay.
You'll be fed, and then they will do follow-up reviews. You'll be given antibiotics, medications, and then later an assessment will be done again to see if the fistula is closed. Yes.
So how is the stigma around fistula affecting women emotionally and socially? Because obviously when I started my intro, it's something that is happening, but it's hidden because of the stigma around it. So how does it affect women?
So that is a big problem, because because of the continuous leakage of urine and stool, a lot of women are not able to go through their usual daily activities. Some of them smell of urine and stools. They can't go to public places. Marriages have been destroyed because of this condition. Sometimes they are cast out of the community because of this condition.
They are cast out of the community for bringing out a child and having complications from that.
Yes, in certain instances that can happen. And homes have been broken because of this.
All right, so what steps has the Ministry of Health or the GMHS actually taken in recent years to, say, educate people in Ghana about this issue?
Okay, so we have partnership with the United Nations, UNFPA, and we are currently doing multi-site repair of these fistulas all over Ghana. So as I said, we've done case mobilization. Facilities like Komfanochi Teaching Hospital, Ho Teaching Hospital, and then Tamale West Teaching Hospital are actually doing repair of these fistulas. We've also mobilized a team of specialists and doctors who are going to go through, do the repairs for us.
Right.
Yeah.
Right. Talking about the repairs and mobilizing doctors, is there like enough training for rural midwives and nurses to recognize these issues?
Yes. So it's part of the mobilization. We actually have had interactions with the public health nurses in the various communities, and they have been trained on how to recognize some of these things, these conditions.
Right. So even a woman in the CHIPS compound?
Yes, they are aware. They are aware of what a fistula is. And they, once the symptoms or the patient tells them what it is, then they can then send to a doctor who will do the necessary assessment, screening, and then decide, okay, this is a fistula. If the fistula, if it comes out that it's an obstetric fistula, then the woman goes into the system to have free repair done for her.
Yeah, so you keep saying obstetric fistula. Are there different types of fistulas? Yes,
we have different types of fistula. This is mainly due to childbirth.
Okay, so there's the anal one.
Yes, there are anal fistulas. So fistula basically means there's an abnormal communication.
Right, right. Wow, this is actually very interesting. So how many cases have you guys worked on so far?
Okay, so
let's say this year.
So today, for example, we are aiming to do about 50 repairs in the centers. Yes. Yes.
Are they in Accra?
No. The multi-site centers. Wow. So we are doing quite a lot. There's been studies that has been done in some years back that says we have about 1,300 fistulas in a year. Okay, about 1,300 fistulas in a year.
Right.
We do repair a lot of them, but this is also one of the important aspects of this day, to do the case mobilization, bring them to a facility and get the repairs done. It's going to go on throughout the year.
Right.
Yes, but today is...
Is it free?
Yes, it's free surgery.
Wow. And how long does a surgery take?
It depends.
All right. So, okay, now, before you answer the it depends part, so does the longer you stay without talking to a doctor, or say you are hiding this issue, actually affect the amount of time that will be used in your fistula, or it's just about how big it is that will actually affect the amount of time that will be using your fistula?
Yes, so it depends. It depends on the size, it depends on the number of fistulas.
So there is actually like a size?
Yes, there's a size.
So how big can they get? Okay, from how small and how big do we... Oh,
so
I'm a very, very graphic person, so I want to imagine it, so let's see.
Okay, so if it's a very tiny fistula, then the repair tends to be a bit easier. But
what size are we looking like?
Okay,
a pea size?
Very, very small.
Yeah,
very
all right, so it's a tiny size,
very, very tiny fistula.
And what's the biggest size that you can get?
Oh, you can get huge ones.
Like that?
Huge ones, yes.
Like a tear?
Yes.
From the tear, like between the vagina and everything? This big?
Yes, you can get huge ones. So it depends on what may have been whatever may have precipitated that fistula from occurring. Yes.
So let me see, the more you stay without talking about it, does it increase the size?
So generally so the most important thing is that when it occurs initially and a repair is done, it's much better.
It's much better?
Yes, than when you wait for a longer time to get the repair done. So that's the most important thing. Because when you wait for a longer time, then there are other factors that comes into play. Risk of infections, and then your nutritional status as well. All these are factors that occur, come into play. But immediately it's recognized and it's repaired at that moment, it's much better.
Right. So you work at the GHS, that's the Ghana Health Service, and I'm sure you have some data that we do not know about. So when you look at Ghana, which side has the most cases of obstetric fistula?
So we're looking at the northern part of Ghana, Ashanti region, and then central region.
Ashanti region?
Yes.
Wow. That's serious. So look at the camera. What will be your final words to anyone that has this issue right now?
Okay, so obstetric fistula is not a death sentence. It's just like any other medical condition. Treatment is available. It's not caused by witchcraft, ancestral curses, or any of that, those myths. Currently, if you know you have this problem, you can just go to a health facility or even contact any medical person. You'll be brought in for screening, and if indeed it happens that you have obstetric fistula, it's going to be repaired for you for free.
All right.
I would also like to say, so this leaking urine or stool after childbirth, it could be a fistula.
Right.
Painful or
painful but
treatable.
Yeah.
Yes. Free surgery is available.
Yeah.
We have here the numbers that are there. You can call any of these facilities and help will be provided.
So we have Tamale West Hospital, Comfort Noche Teaching Hospital, Mercy Women's Catholic Hospital, and Whole Teaching Hospital. Yeah.
Yes.
So fistula causes shame and pain.
Yes.
But don't hide it. Yeah. So let's end the silence, guys. Let's end the silence. So if you have your sister, your wife, your female friends, your aunties that are going through any of this, please, 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 it's time for you to be serious about these issues. But then I want to say a very big thank you to you, Doc. I think we have a question for you. We have a question from one of our viewers. Does fistula affect sex drive after repairs?
After repairs?
Yes.
Oh,
please
wow.
let the person heal. That's what I was saying. Let us heal first.
Let her heal first, and then you can engage in other things.
Yeah.
But once you have a fistula,
how long is the healing?
It depends on the doctor's discretion.
Yeah.
If the doctor assesses and feels it's okay for you to engage in sexual activity, they can tell you.
Right, right. All right. Okay. It's been an interesting conversation. Thank you so much, Dr. Francis Eshun Baidoo, who's the Safe Motherhood Program Manager at the Family Health Division at the Ghana Health Center. It's been an interesting conversation about obstetric fistula. Like I said, it's a mouthful. Yeah. And I'm glad that we are actually talking about this. So if you know anyone out there that is suffering in silence and, doesn't know what to do about it, please, 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 the numbers. Please, let's have the numbers on the screen again. So try to call any of the numbers at any of the centers around you. If we can have the numbers on the screen again, that would be nice. Call. And then, get yourself sorted. Tamale West Hospital, Comfort Noche Teaching Hospital, Mercy Women's Catholic Hospital, and Whole Teaching Hospital. You don't need to hide this again. Let's end the silence, please. All right? And thank you so much. Thank you so much, Doc. It was really nice having this conversation with you. So